So Jennifer, thank you again.
Well, thanks for having me. I'm so excited to be here, and I'm always happy to help Shannon. This is a topic that is an everyday occurrence for me. So many of you have already listened to my one of my talks, which was about the 10 medication. I don't remember the title, but it was about medications and safe medication management. And today we're going to talk about urinary tract infections and specifically about and behavioral changes. And it's really, I'm going to keep admitting people too. So when we're dealing with folks that have Alzheimer's or any related dementias, it's definitely different than when any of us on the call get a urinary tract infection. And I'm sure most of us have had them before, but it is very different when somebody is experiencing it, has memory disorders. So I'm Jennifer Prescott. I'm the owner of Blue Water Home Care. We're a locally owned and operated home care agency, and we're non-medical, so we do bathing, dressing, grooming, meal preparation and planning, help people age in place safely, try to do it in the most cost-effective way. And we also do help people that are in communities as well. And we've noticed a lot more facilities have contacted us to help their loved ones because they're not able to see their loved ones due to COVID-19. And we're able to provide just an extra set of eyes and hands to care for folks. I've been a nurse for 25 years, and it is truly a privilege to do what I do every single day. I probably about 15 years ago is where I sort of found that love for taking care of seniors. I knew that one day I'm going to be a senior. I'm knocking on the 50s door, and I just think it's really important. Taking care of people in geriatrics is something that a lot of times people don't like to do, and we're noticing that there's a huge shortage in geriatricians right now. There was an article a couple articles I've read in the past month about that. So today we're going to talk about urinary tract infections and behavioral changes. Please feel free to jump in. You can unmute yourself. We want this to be a conversation. I've got a short presentation for y'all, but I really would like this to be an open conversation where you can ask me any questions that you have. We're here from 2 to 3, so whatever questions that you have, I'm welcome to share it with you. So let me get my slideshow here, and we'll get started. So my husband and I own Blue Water Home Care, and we started about 3 years ago. So what is a urinary tract infection? So most of us know this. This is pretty simple. A urinary tract infection is an infection of the urinary tract. Most commonly, we see it in the bladder. So
Okay, thank you.
almost everybody on this call, I'm feeling probably does have experienced it before. And for those of us on the call, we've experienced it, it's very painful. Usually it comes on sort of dull, you kind of feel it coming. We start to drink a lot of water, maybe have some cranberry juice, and then sometimes we can fix it and sometimes we can't. So, all right, let me keep going here. Hold on, I'm a little frozen. Oh, here we go. Okay, so what are the symptoms that we have? First is usually frequent urination. So what does that mean? That means, you're going to be going to the bathroom or urinating. It could be, once an hour. It could be once every 30 minutes. When you get really bad, it might feel like you just sort of want to sit on the toilet and pee. And you kind of have that urgency. So urgency means you have that desire to pee, but you can't get anything out. Like you just feel like you consistently have to go urinate, but nothing's coming out. Also pain with urination. So that's usually a pretty telltale sign that you may have gone past the point of return where you can actually, treat this with, cranberry juice or extra water. I can tell you that the research studies actually don't really support fully that cranberry juice works. My view is this, and what I tell, I'm not a physician, but I tell our clients, whatever you can get inside of somebody, like hydration wise, is going to be helpful. So if it's, I wouldn't do orange juice because it's really acidic, but if it's cranberry juice, if it's apple juice, if it's just water, whatever it is, just no sodas or really a lot of caffeine, that doesn't help. And then you may see some blood in urine. The thing with the blood is if you see frank red blood in that urine, that is something where, you've passed that point of return. You need to, see your physician or contact your physician immediately because it's going to get worse. Sometimes you actually can't see the blood. So it'll be so microscopic that you actually won't be able to see the blood. So just keep that in mind. Sometimes you will have urinary tract infections that don't have bleeding associated with it. So what's different? So when somebody has Alzheimer's disease, the symptoms that you see are going to be very different, okay? The first thing that we tend to see is we see agitation and we see restlessness. It may be as simple as like a behavior or a mood change. So it may not be something really overt. It may be that they're cranky, they're unsettled, they're not feeling well. You may have an unexplained sudden incontinence. So what that means is that normally they're using the restroom or they're using, the bedside commode, but then all of a sudden they're wetting their pants. And so that's a sign that something's not right. Because you're going to know the baseline of your loved one. Fatigue. So are they tired? Do they want to sleep more? Again, look at your person's baseline, and that's how you determine, so are we different than the baseline? You may see a low-grade fever. You may. Keep in mind, this is not an all the time thing. You may not have it sometimes too. So don't use having a fever as something that is a telltale sign that if you don't have a fever, you have a urinary, you don't have one. So keep in mind that's something you may see, but we don't always see it. Withdrawn behavior. So withdrawn behavior is definitely something that we see a lot with urinary tract infections. It's, again, if you have someone that's usually wants to sit up, wants to get up early, at 6 or 7 o'clock in the morning, and they're sleeping till 8 or 9 or 10 o'clock, in the morning, these are the types of things you need to ask yourself. What is my loved one's baseline and where are they now? Hallucinations. Hallucinations usually come when we're pretty more advanced down the pike with a urinary tract infection. Although everybody is different. So, you may have someone who has Lewy body dementia, who hallucinations are something that they see all the time, then it will be much more greater. So you may see hallucinations, you might not. Again, these are possible symptoms that you may be seeing. More agitation, confusion, that's usually one of the things that we start to see first. It's just a little bit of confusion that we're seeing. And that's sort of something that you're like, okay, let me keep an eye. And that's why you could use this, take a look at the notes that you're gonna write down from the presentation, because these are just some of the things. You may see some of them, you may see one of them. So just keep that in mind. You may also have dark or cloudy urine. Sometimes that's hard to determine if somebody is incontinent usually and wears briefs. It might sound weird, but if you notice that distinct smell in the urine, so think about, each one of us overnight, we're not obviously drinking in the middle of the night, and we have our first.
Yeah, good. Short day.
You guys good? If we have our first urination in the morning, we notice that it's much more a stronger smell and it's darker. So, and usually, hopefully that's progressing along the way when you're going through your day. But if your loved one, if you're noticing that's a real foul smelling urine, that's something that's consistently happening throughout the day, we're going to talk about things that you can do to help. But that's one of those things that need to just put your little spidey sense up in your brain and think, okay, maybe we need to push some fluids. And we're going to talk about some of the specifics. Some of the things that we see, I can tell you probably in my work, very commonly is falls. Everything's fine, then all of a sudden, mom or dad falls. Just happened yesterday. We had a client family that called us on the phone. Their person was at a memory care facility locally, and they ended up, they did not break anything, but they ended up with, bloodies, their eye was, they had a huge gash in their eye. They had another gash above their other eye. They had, they were doing a CT scan to make sure they don't have a brain bleed. I mean, it was a pretty significant. They had gashes on their legs. You'd be surprised, when we get older, just one little fall that you would think that maybe if you and I had that fall really wouldn't do much. It can be significant for someone with advanced age and a senior that has, Alzheimer's. So in this case, the person they found out actually did have a pretty significant urinary tract infection, which was the cause of the fall. But that could have ended in a fracture. Luckily, this person did not have a fracture, which is a blessing, but this could easily have moved into something like that. And things can change very quickly. So keep that in mind with your loved one. So, what is the most common cause of the sudden increase in confusion in people with Alzheimer's or memory deficit? Somebody jump in. It's a loaded question. I know somebody knows.
It's a UTI?
That's right. That's right. It's a UTI. So a UTI is the most common cause of a sudden increase in confusion with people with Alzheimer's or memory deficit. So pretty simple. Okay, so what are the risk factors? Okay, so these are important and these are good. You know, these are not just for seniors or actually for anyone, but changes in someone's immune system. Okay, so someone's on a steroid that actually will make you have an increased risk. Have you had prior urinary tract infections? That's one of the things. Did you know that females are much more likely to have urinary tract infections than men? Does anybody know why? Anybody know?
Because the urethra is shorter.
That is right. Who said that? I can't see.
It's Joy.
Hey, Joy. You got that right. I wish I could give you like a prize. I'll give you a little clap. You got that right. That is the answer. That is the answer. The answer is because the females have the urethra is shorter. And so there's a shorter segment. Okay. So prior UTIs. So, and I know a lot of friends that have, they have a lot of UTIs, and that is something that can make you more at risk as you age. As somebody has a catheter. So that's pretty common sense if somebody has a catheter. So usually they change the catheters once a month if you're in home care. So because anytime you go into that area, obviously it's something that, you know, we increase the risk of infection every time we're going into the bladder or we're going through the urethra to the bladder. So keep that in mind. If you have a loved one that has a catheter, you want to make sure that you are keeping track of when the last time that catheter was changed. So I know that a lot of practitioners are doing virtual visits now, even health and hospice are doing some virtual visits too. So please be, you know, a good steward for your loved one and keep a journal and write down the last time that the Foley catheter has been changed. So that's very, very, very important. And again, it's about every 30 days. Some manufacturers are different, but usually it's every 28 to 30 days. So incontinence. So anybody who is incontinent is at risk of a urinary tract infection. So, and we're going to talk about some of the things that we can do if you have someone that's incontinent or if you yourself are incontinent to try to help this. You can also have prostate hypertrophy in males. So with an enlarged, that's just an enlarged prostate. That makes you have an increased risk for you to have a urinary tract infection. The other part is exposure to bacteria in your facility or a hospital. So the most common type of infection when somebody has a urinary tract infection is the bacteria E. coli. And E. coli is everywhere. It just is. And so it's really important that, you know, if your loved one has a catheter or anybody's providing personal care, that you're making sure that they're using proper hand hygiene. And then obviously we're going to be very careful when they're changing a catheter as well. Because when you're exposed to the bacteria that's normally there, if it can go into that, especially for women, it's a very short space, that can make you have a urinary tract infection. And the more that we take antibiotics, the more resistant our bodies become on those antibiotics. So that's kind of a problem. So the other risk factors are, do you have diabetes, do you have kidney issues, or do you have a weak immune system? And all of those types of things sort of add to an increased risk of getting a urinary tract infection. That doesn't mean that you will definitely get one. It just means that you're at risk. And I think that we're going to talk about some things and some strategies that can help you so that to try to avoid it. So how is it diagnosed? So the most simple is a urinalysis. So there's also with a CNS. So CNS just means culture and sensitivity. So that just says, what do you have? So what is the bacteria that you have? And what is the medication or the antibiotic that best is able to treat that? And so that's why sometimes you'll hear your doctor or nurse practitioner or PA will put you or a loved one on a broad spectrum antibiotic. That just means that it will treat many different types of bacteria instead of just one. But then once they do the CNS or the culture and sensitivity, that will actually show you the specific medication that will help treat that type of bacteria. You can also do x-rays, they can look at that. They can also do ultrasounds that can help to diagnose urinary tract infections as well. Bladder retention is something that is common. There are people that have bladder retention that also causes you to have an increased risk of a urinary tract infection. So how do we treat them? So pretty simple. Well, sometimes. Antibiotics are the first. So I would say even before the antibiotics. So the first thing you want to do is, we're going to talk about prevention, but increasing fluids just in general is a really good idea for everyone. That is one of the areas that I probably struggle with the most, because I get caught up in my day.
Outside the door. Yeah.
I get caught up in my day, and so I kind of forget to drink. And so keeping a water bottle with you, not having, caffeine, unless little bits are okay. You can have little bits, cup of coffee or something, once a day, or, 2 cups of coffee or whatever is fine. Just don't just have the coffee and have that replace all of your fluids. Because I can tell you as a nurse, I've gone days where I'll go like a full day where I will have, a coffee, and then I won't drink anything else until the end of the day. And that is not a good thing to do. So you have to be intentional about what your intake is. So they also can obviously treat with antibiotics and cranberry juice. So we already talked about this. So there really isn't any support in the medical community that really does necessarily help to prevent it. I can tell you that it is something that is good to use. It just is probably not something that's going to necessarily cure a urinary tract infection, but it can't hurt. So that's usually my go-to also. All right, so prevention. So I'm all about the prevention part. So we started to talk about it. Drink plenty of fluids. So what does that mean, drink plenty of fluids? It's, they really want you to have, there's all different ways to go about it. I mean, I think 8-ounce glasses a day is a good idea. I know that's not easy to do. Some people even say drink more than that. There's all different things that you can go online and find out. I think just being intentional, you don't want to go through your day and at the end of the day be parched and feel like you have to drink. One of the easy ways to do it is look at your urine. If your urine is really, really strong smelling, or if your urine is, really dark, then you're not drinking enough. Same with your loved ones. So I know it's hard to do when you're looking at a diaper. And I know that's one of the things that a lot of you are taking care of people that are, in a brief, as I prefer to call it, a brief, or they're using those little poise pads as well. But the smell, just make sure that you're smelling it to make sure that it's not a change. If it's usually like this and they're drinking a lot, you're okay. But if their behavior's changing and you're noticing that it's smelling a little funny, you may want to, contact the doctor and already increase the fluids for your loved one. So avoiding caffeine and alcohol. So the reason why people say to avoid caffeine and alcohol is really about dehydration. So we want to, and I see Joyce drinking water, which is awesome. It's not that you can't drink caffeine. It's just that you want to make sure that you're drinking other things too. And not a lot of sugary things. You want to make sure that you're drinking, water, because water really is the most hydrating. Some of the simple things, which can be easier said than done, especially if we're taking care of folks that have some memory disorders. Again, with a female, wiping front to back. And, it's really important. And if you're taking care of somebody that's bedbound as well, that you really make sure that you're doing a good job cleaning those areas. I would use a separate wipe every time that you wipe. So you may need to, I know the baby wipes, honestly, if you use coupons, tend to be less expensive than those giant wipes that you can get. I know a lot of the folks that we care for, their loved ones buy the giant wipes and they're like this big, but there's maybe only like 20 wipes in a container. And I personally, when I'm providing personal care to our clients, I make sure that I'm always doing from front to back. And I always make sure that I'm using a new a wipe every single time I'm cleaning the area. Then it's completely cleaned. And you have to make sure that you get into all the crevices. You just do. So it's just like, that's really important because, you know, in females, those areas are really close together and it's really easy because if you don't want to get stool, you know, into the urethra on a female, like, and it can be for a man as well. So you have to be really careful about that. Promptly changing incontinence pads or underwear when wet. So anytime that we have that area, it's a breeding ground for bacteria. Okay, so every 2 hours, and if you know somebody's had a bowel movement, you need to make sure they get taken care of immediately. Again, your facilities as well in communities, making sure you're having conversations with the community leadership and making sure that they are changing your loved one every 2 hours, making sure that they're doing rounds to make sure that they're not sitting in, you know, a wet brief. All of those things and those incontinence pads, you know, those incontinence pads are great, the little poise pads, and they can go inside of a brief and you can put 1 or 2 in there and then you can just pull one out. The thing is, we just want to make sure that we're not just pulling those incontinence briefs out and we're not actually changing, because that's a hot area. I mean, you know how it is, especially we're in Texas. So when you have those briefs on and you have those pads on, I mean, it can be really hot and that could be a breeding ground for bacteria. So we need to be careful, really, really careful. There you go. So those are sort of the main, I'm going to stop my screen share because I want to see you guys and all these pretty faces. So those were just, I wanted to give you guys sort of like the nitty gritty, the down and dirty of you know, what are the things that we need to look for UTIs. So what are the questions that you guys have? I know that you have life experiences that you're going through right now. What are your questions that you have about UTIs and behavioral changes?
I would like to know, how do you push fluids when they don't really want to drink? It took me a half an hour one day just to get 8 ounces down.
Yes. So a couple things. Have you tried, so it doesn't, so liquid comes in different, you don't have to choose, so fluids don't have to necessarily be in liquid fashion. So if you can get them to have a popsicle, like a treat, is that a possibility?
That I haven't tried.
So I like popsicles. You can buy regular popsicles. They're more sugary. You can buy the fruit popsicles, which I prefer. You can also get Pedialyte popsicles.
Really?
I think there's Pedialyte popsicles. I think I've seen them, unless I dreamed them. I might have dreamed them. I do have 4 kids. Yeah, so, and then Jell-O is a good fluid. So again, it's not exactly the consistency of water, but it is a liquid. So that's another option too. And you could do a sugar on that as well. Anybody else have any good ideas on fluids? Because I think that's one of the hardest.
I was just going to.
Go ahead.
No. I was going to second that, Jennifer, because I have my Jell-O here. I have my my like sips of my Gatorade Zero, so I'm getting my like fluids in. And I did use the popsicles too for myself. Just trying to get different ways to get fluid constantly in me. So find different ways if they're not wanting to drink and if it's hard for them to swallow, see if they can do the popsicles or Jell-O. I find that to be soups, like broth is another one too, that I've been doing a lot more of soups and just kind of just eating sipping on the broth of the soups. That works as well. I think someone put that in the chat box as well.
Oh, good. Here. Oh, that's great. Here, I'm going to pull the chat up. How about soups? Yes, soups are perfect. So there's a few different things. You can definitely do soups. You can do Jell-O, like we talked about. You can do like smoothies. If somebody has trouble swallowing, make sure that you get with a speech therapist and you know exactly the consistency that your loved one can or cannot have. That's important. There's also, I grew up on the East Coast. I don't know if anybody else grew up on the East Coast, but there's the ice, what are they called? The Italian water ice. I know there's a place called Rita's here. I know there's one where everybody is, but there's a place called Rita's water ice on Palmer. It's like off of Palmer and maybe McNeil-ish. I don't know if because of COVID if it's still open, but man, if you've never had Rita's water ice, it's still
Or like a snow
Would
cone.
you say that at
Mhm.
Yeah,
Mhm.
Rita's water ice. Yeah, I'll put it in the, it's like a snow cone. Yeah, but there's all different, I'm going to put it in if I can type correctly for y'all. It's hard, especially when people have memory issues. It's really, really hard. People said, what about milk? Yeah, if they'll drink milk and it's not contraindicated, it's really any type of fluid. I think just think to yourself a little bit outside the box. You don't necessarily have to be just like the water or the liquid like we think of. It has different fashion and forms. So ice cream, milkshakes are good. How about using electrolytes for flavoring? Sure, you could do that with magnesium. That's a perfect thing for leg cramps. That's great. Somebody also told me about soap. I don't know if leg cramps, I don't know, like some type of soap in your shoe or something. I don't know if that's a real thing. But yeah, you could
So I don't
do that. I don't know.
I don't have experience with this, but this is kind of like outside of the box. Maybe you could come up with some sort of drinking game.
Yeah.
Like take a sip after this or, and so it's like a distraction, but you're still getting the fluids down.
That's a great idea. I think that one of the things with folks that have memory issues is that they want to, so you have to do it with them. So if you're trying to get them to eat or trying to get them to drink, you want to do the same thing. And one of the big things, and this isn't urinary tract infections, but with folks that have memory issues and advanced dementia or whatever, absolutely don't give them a giant full plate of anything. Small plates and eat with them if you can. That they can mimic what you're doing. And sometimes you have to, obviously assist them as well. But those are all really good ideas.
I wanted to tell you, I said I had a half hour to get this. I was sitting there with my cup. Take your cup up like this and we'll drink. And you should have seen how much I drank.
It does work.
I drank a lot.
Excellent. Excellent. It does work. I mean, some days are going to be better than others. Just also making sure you're watching the types of foods, like high salty foods is going to make your loved one a lot more dehydrated. So, if they're not eating a whole lot, make sure that you're choosy on what you feed them, because you don't want to give them foods that are very, dehydrating. Things like salt, really a lot of salt things are going to be dehydrating for them. So you don't want to, I'm going to admit Keith here, hold on. You want to make sure that you're, aware of that as well. What other questions or just comments or shares? Because, a lot of you're living this. I take care of my mother-in-law who has early stage Alzheimer's, and she's not to the point now where she's still, independent, but we help her a lot. We do her medications and we do meal preparation and planning and all of that for her. And so, many of you have just amazing best practices. Like, I would love this as an opportunity for everybody to share, anything that they've done that are good best practice with preventing urinary tract infections.
So I have a question. What is it about the Alzheimer's that makes it so that when someone has a UTI, they experience all this confusion? It's like a non-Alzheimer's person doesn't have these issues. That to me is just, it's like, where's the relationship between the UTI and the brain? Like, I don't understand that part.
It's their inability to communicate to you. It has to do with just and that's their way to communicate. So they can't tell you, you know, I'm having frequency, I'm having urgency, I'm having.
No, that's not what I mean. I mean that you can, even without a urinalysis, you can tell
True.
when there's a UTI because of the mental confusion. But
Sure.
what is the infection doing to the brain that's making it confused? Like, how does?
I'm not sure that it's necessarily doing anything directly to the brain. I mean, it could. I just think, so one of the things that we look at is, so one of the telltale signs, at least for me when I've had a urinary tract infection, and for most of you, I'm sure, I don't know about men, but for females, it's usually is frequency, urgency, and pain. You know,
it's just the mental confusion that it is like, it seems out of place on the list of symptoms.
Yeah, I mean, I think it's just one of those things that's just an outward symptom. They can't describe to you how they feel. And then, you know, if they have an infection, you know, when we have infections or we have a fever, and a lot of times it's not a fever, but we don't feel right. You know, we just feel off. And
we don't have hallucinations.
We do not. And I don't see it that often with the hallucinations, but I have seen it before.
That's just wild.
It is wild, but it's really their outward, it's their outward way to communicate to you. So like pain, there's something called a FLACC scale. It's FLACC. And it's a scale that we look at it's a nonverbal communication of way to communicate about pain. And a lot of those things that you see on the FLACC scale is like grimacing and agitation. And those are types of things that we would look at for somebody that would be showing outward signs of pain if they can't communicate to us if they're in pain. So I think it's all related. But obviously, if somebody has a significant infection, that is going to impact their whole body. I mean, it will impact their neurological system. It's going to impact everything. So, and then if they have a fever, then that's going to be much more an outward sign. But typically, we don't see fevers till much more advanced.
Thank you.
Sure. What other questions do you guys have? Have you guys ever experienced a loved one? What symptoms are you seeing with your loved ones that have had, you know, urinary tract infections? Anything outside of what we've already talked about?
Hi.
I would say really weird behavior.
I recently had an experience with my husband with a UTI. It was July 31st, and he has early stage Alzheimer's. And that day, that afternoon, he told me that his heart felt slow. So I took his blood pressure and it was incredibly low. So I called the doctor's office and I was told to call 911. So I did. And they wanted to take him to the hospital, but he didn't want to go. But I told him he had to go. He had not complained of any of these symptoms that you had said. And I didn't have any experience with it. But anyway, he ended up at the hospital and they wanted to keep him. They said he had a UTI. He didn't want to stay, but I made him stay. And he spent the first night in intensive care unit.
Wow.
And he ended up staying 2 nights in the hospital. And it was because of a UTI, and I didn't have a clue that he had one, and he didn't either. And I didn't even know having an infection made your blood pressure low. So I learned a lot, but now I know. I think that maybe he was a little more confused, and I just didn't know that that was a sign to look for.
It's true. It's true. And I hadn't heard that before, you know, with the blood pressure, but it makes sense, you know. It all makes sense. I think knowing the baseline of your loved one, and all of you that are caring, you know, for people in your homes, you know the baseline of your loved one. You know when something's not right. And if you need to push to get the answers that you need, you know, I want to encourage you to contact your physician, because I know right now with COVID, a lot of people are afraid, you know, to go to the hospitals and all of those type of things and worry that, okay, your loved one will be there. There are some times, I don't know, Kathy, your experience, but we are seeing, in my experience with our clients, that at least in the emergency room initially, if somebody has a memory disorder, they are letting some people in some emergency rooms in the emergency room with that person.
They wouldn't let me in. So.
Okay. And I think it just depends on the emergency room. But I do think they're doing a lot of things. I would encourage you to not wait it's just like you knew something wasn't right, you called the doctor, and then luckily you were able to get it taken care of. Because what happens sometimes is that if it's not taken care of quickly and we're not identifying things quickly, then it can be really progressed, and then they have to be in a hospital for, days or weeks or months. Or even worse than that, they may have, like a broken hip or broken leg or broken arm because of a fall. And that happens all the time. I mean, all the time. And so it's good that you were on target really quickly and you identified there was an issue, Kathy. So I'm so glad you shared that. Thank you.
Okay, you're welcome.
What about using over-the-counter urine test strips?
I don't feel like I really could even speak to that. I'm not familiar with them. I think that's a question for your doctor. I think that would be a perfect conversation to have your doctor or nurse practitioner and ask them, what's their experience with it? Do they have a brand that they trust and use? The thing with that is that my guess is that would be like a urine dipstick, and it would be like a little, do I have blood in my urine, or are there protein in my urine, or whatever? But that's not going to give you the full thing like I was telling you about a culture sensitivity, because you want to know what medication would actually be appropriate for that infection. And so it's very common for people to say, okay, well, I think I have a urinary tract infection. I want you to prescribe antibiotics. And I think most of us know now that, we don't just want to prescribe antibiotics. We want to prescribe the right antibiotics at the right time, for the right client. So I'm not familiar with that, but that could be a good, if your doctor was on board with that, that could be a good, quick diagnostic if you think that things are, not right. Has anybody else had experience with those urine dipsticks? I just haven't.
I just wondered, because of COVID, if that would save somebody a trip to the doctor's office or the lab.
I tend to just err on the side of, contacting your, physician or practitioner and kind of going that route. I do know that they are doing, a lot of really good things to keep the places safe. I mean, lots of, sanitizing in those areas, like very, very, very closely monitoring to make things are, clean and neat and really just sanitize. So there is a way to safely, I don't want to see is that people are avoiding to a doctor, out of fear. And I know it's hard because a lot of the physicians' offices, I don't know if you're experiencing this, but what our clients are seeing is a lot of their practitioners are doing telemedicine visits. And there's a lot of things you can do with telemedicine visits, but there's other things like labs and urinalysis and things like that, and more complex testing that you can't necessarily, do via a telemedicine visit. So I would definitely encourage anyone that's having any issues with your loved one, if you're not getting the answers that you need, if you need to, seek a different physician, or you need to, elevate this or whatever, please, feel free to do that, because you have to be your best advocate for your loved one, because you know them better than anyone. Any other questions that you have about anything, if I can answer it?
Hey, sweetie.
I just added Bob in. Hi, Bob, welcome. Do you guys have any other questions?
Hello.
What were you going to say? Go ahead.
You want me to say something?
Oh, no, Mr. Bailey, I was just welcoming you.
Well, I had forgotten all about it first place. Then I had trouble signing up. Now I'm confused. What's next?
Well, we just talked about urinary tract infections and behavioral changes. And we are recording this, so we will get this. I think we can get this posted, can't we, Shannon?
We are definitely, as soon as it uploads, if you can send it to me, Jennifer, and I will send it to everybody who signed up, so that if you join in later on, we can watch the recorded presentation. Jennifer did a really great job of explaining all the symptoms. She explained ways of treatment. So she really did a great job outlining what urinary tract infections are, how we can do different strategies to prevent them. I think they were all great tips. So know that the fear of maybe going to the doctor is there, but I know in our, like Jennifer mentioned, in our area, even doctors were even seeing people in their car. So if that might be another option, if you suspect that your loved one may have a UTI, and you can talk to your doctor and see if they can, that way you can stay with your loved one. And they're, we're out in Leander area, and I was watching visits. We're doing them in the car. The doctor was, and the nurse practitioner was coming out. So it's happening. Doctors are getting creative. They're doing the telemedicine, finding different ways during this time. But it is something that if you start seeing these changes, doing some of these preventative measures and getting treatment for that quickly is important.
Well,
I agree.
I appreciate your help. Some of us old men need a lot. Is there any way I can just record in or listen in to what's already been recorded?
Yes.
Absolutely. I will say that to you.
Well, see, I can't even hear you. I'll turn it back up a little bit.
Mr. Bailey, Shannon said that we're going to send that to you in email, so you'll be able to see the recording via your email, okay?
That is wonderful. Hug everybody's neck for me. Thank you, dear.
Aw.
Thank
Well, you guys are all heroes in my book. I know that most of you are probably taking care of folks that are dealing with memory disorders or Alzheimer's and dementia. And so you're all heroes in my book. Give yourself a hug, pat yourself on the back. You have a lot of people that are there to support you. Please know that Alzheimer's Texas, you call them anytime. They will help to connect you with amazing resources in our community. Feel free to call our office if you ever need us. We're just really happy to be there and support our community. You are why we do what we do every day.
Well, sounds like a good deal.
All right.
Thank you also. And when I
Thank you.
send that email for everybody, I'll include Jennifer's contact information so you can reach out to Blue Water as well. And if there's anything that we can do, thank you for joining us this Wednesday again. I appreciate it. I know that the weather is not, the best right now, so probably people had trouble logging in. We had internet issues, so I appreciate Jennifer as well, taking that lead and helping me out as well. So thank you again. I look forward to seeing you all next Wednesday.
Okay, very good.
Thank you.
Bye,
Bye-bye.
everybody. Stay
Bye.
dry.
Thanks.
Have a great one.